Hello, my name's Jackie Brearley and I'm Director of Studies for Clinical Veterinary Medicine at Lucy Cavendish College. My background is very much in the clinical work. When I graduated from Cambridge, I went to work at Glasgow, doing the equivalent of an internship, and then moved to Liverpool Vet School, where I did my postgraduate certificate and then diploma in veterinary anaesthesia, and then went on to do a doctorate looking at stress in cattle, in particular stress associated with anaesthesia and surgery. I then moved back down to East Anglia to the Animal Health Trust and worked there as a clinical anaesthetist for some time prior to coming to Cambridge. I took up a post of University Senior Lecturer in Veterinary Anaesthesia in 2006 and at the same time became a Fellow at Lucy Cavendish College. I really liked Lucy because it was very inclusive and it was a very friendly atmosphere when I came and looked round, and that has continued up to this day. In terms of what I do up at the vet school, I've moved away from clinical veterinary anaesthesia now, although I still do 3 afternoons a week, and now I look after the clinical skills facilities up at the vet school. So that's teaching practical hands-on skills such as handling animals, learning how to suture, gloving, gowning for surgery, taking samples from animals, doing injections, and things like that. So very much practical skills, and that's where my research interests have moved to as well, looking to see how people learn and not just learn by memorising things and by cognition, but how their muscles learn as well as their brains learn, which is great fun. I'm involved in the selection process for vet students at Lucy Cavendish because it's important to have a clinical perspective to see what sort of people we think will make good vets, and it isn't necessarily always people from from backgrounds that involve a lot of animals. So we look for people who have an empathy. We also look for people who have the willingness to learn and who have a real passion for looking after animals and promoting animal and human health through animal health as well. We want people who can think outside the box and who in some cases aren't necessarily from traditional backgrounds. So increased diversity and having a big mix of people is really what we're looking for. Along with Jane Gretorix, the preclinical director of studies, we try and maintain some sort of community amongst the vet students at Lucy. So we arrange social events with the students, and the students arrange them by themselves as well. We've been to the Horse Racing Museum at Newmarket, and we've done other things as well, looking at lameness in horses and looking at Jane's horses, and sometimes people have come out and look at my sheep and my pigs when I have them. Outside veterinary medicine, as you probably by that last comment gathered, I have a small holding about 15 miles outside Cambridge, where I run a very, very small flock of 13 ewes and 3 rams. Most of the sheep are Hebrideans. They're very good at looking after themselves, and I have 5 Llanwynog ewes as well.